Unfortunately, we got three losers here. We got three molars with root canal treated teeth that have no crowns on them, and they're failing. Decay, fracture, decay, and no crown here. So winner, winner, winner on the implant, losers on the other three. She is planning on getting this crown done, and I'm not sure. This one is hopeless now, and I don't remember what's going on with that. So we're going to talk about 29 and number 3 in this case. Let's look at the treatment assessment real quick. That is a green on bone density. I love that. The facial bone on the natural teeth in the number 3 area is a yellow, and constriction's a yellow. Detached gingiva is green, and the sinus bone is yellow. The rest are green, so things look really pretty good here. So let's jump into number 29. Obviously 30 needs to be checked, but also just gets crowned over. No big deal. You can do that while you do the implant. So looking right at this site, the nerve looks like the foramen is here, coming out right in the mesial portion of where the first molar is. It comes out a little bit sooner than you would think, so that's a good thing. But look how low that is. That is way down there. Don't have to worry at all about that. Let's look at the slice view here. We're going to go to the CT, and here we go. You're looking at some really nice bone, nice cortication on the outside, softer at the top. And when we put our implant in, that is a 4.2. You can see how the foramen comes up. You have plenty of room here. You can even drop that down. Whatever you want here, you're going to be successful. You're going to hit the walls. It's going to be straight. Just hit it straight down the mesial distal line angle of the two adjacent teeth here, and you're perfectly fine. Just go right down the middle. So that's a very straightforward, easy winner case. It's a starter case because it's a lower on the right side. If you're right-handed, it's easier than if you're a left-handed doctor working on the other side of the patient. But this is very, very straightforward. This is definitely the first implant type of case. Now let's look at number 3 here, and that one is unfortunately now a lost cause. And let's go to this view, and here's you got bone out here, and then it kind of lightens up. So I bet there's facial bone out here, but we got a little abscess. But what I like here is that we've got a lot of bone up here at the crestal part. That's going to fill in nicely. I would still graft because that root is very large, and you're looking at least, at the most I should say, almost 12 millimeters before you hit the sinus. So that's very, very good. If we go back more, we're going to hit into the two roots here, the palatal root and the distal root, but we still have facial bone here. And we're going to graft that, so we should maintain both of these out. And look at that bone right in the middle. That's really great. So make sure you separate these roots on extraction, and you should be well on your way down the road. There are those that like doing these as immediate placements. I don't recommend that at all, so I won't talk about that. If somebody wants to comment on something like that, that's great. But that's not what I would even start off thinking about doing, even though you possibly can get away with it. Just seems like you're setting yourself up for some failure. Anyway, that's a 10 by 5, and that's what my end goal would be. This is going to be about an 8-9 month project. Probably you could go wider than that if you're inclined to have an implant system that goes into the 6 and 7s. Let me go into that. It doesn't usually look that much bigger. And this is Hyosin. So Hyosin will, let's do a 7 by 10. That's what it would look like there. That still has room there, and you still have room here. So if you've got nice graft material healed in there for 4 months, I would say, wow, go for the 7 by 11.5. That's going to be awesome. That's definitely going to hold that puppy up there, no problem. And that's another part of this being a nice starter case. They're both on the right side, so if you're right-handed, most of us are right-handed, you're going to be able to get 2 good opportunities and be very successful. You got a lot of bone here. You don't have to go to 7 diameter, but you get the idea. You really have a good opportunity here. You have a good opportunity here, and that's all that really matters. The rest, hopefully, we can save that, and you can save that, and she'll get back on track. This is an interesting spot because we have a canine premolar molar. Do you feel that? I would probably not do an implant here, but I would recommend possibly closing that because she does have her full occlusion up here, and that would actually enhance. That almost looks like a temporary crown to me. I don't remember, but that looks like a temporary. If she didn't do other crowns there, she should do a bridge here and clean this up so that she has a full occlusion here. Make everything last that much longer, especially the root canal treated teeth on the other side. So that's another pretty straightforward one. Nothing miracles here. Starter cases like this are always pretty fast, pretty easy to talk about. So anyway, follow us on some other some of our other videos, and look for us on the live broadcast. Look at our courses, the basic dental starter implant courses and the advanced courses that are available. But also subscribe to us on YouTube. We appreciate it. Thanks.